Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the consult. We are actually missing our mister today.
We are missing the star of the show. We get to talk about all things females
all
today.
Things ladies, because we're going to get into it. But today we have with us a little bit of a repeat visitor. Miss Connie is joining us from her office today, and we are going to talk about
star of the show, Con.
She got it. She's going to be our lady helping other ladies today with a little problem that we can help with. But before we get into that, Connie, good morning. How are you?
Hey, I'm doing well. Thank you.
All right. So for those of y'all who did not catch Connie on the last episode that she was here for, Connie's the OG, right? Connie and Taylor.
Connie's the OG. She has been with Weiler Plastic Surgery from its infancy and has grown with Dr. Weiler and has made big moves on the North Shore area. She has won over and over. What is it, Con? Tangipahoa Esthetician.
Best esthetician.
Best esthetician in the house.
She's like, I'm sorry, no big deal. I was just so many years. I've just lost count at this point.
It's a great honor.
It is. Absolutely. But think of this visit as girl talk because we all have these conversations.
Yeah.
And speaking outside of girl talk makes it maybe a little bit uncomfortable for people, but I feel like there's less and less taboo as we dive deeper into things because we are all going through it.
Okay.
So normalize
Have you seen the We Don't Care Club thing on Instagram? Has anybody seen this?
No, but I need to.
Okay, there's this girl. Her name is Just Being Melanie or something like that. Perimenopausal girl. And she had this napkin, and it was the We Don't Care Club of, I don't remember where she was at. And it's clothespin to her shirt. And she's talking about all these menopausal symptoms that are, she's like, I don't care. We don't care that I got a chin hair that's been there and I'm not going to do anything about it. We don't care. It goes through all this stuff. We don't care that I woke up my husband last night because he was sleeping peacefully and I was a little bit jealous. We don't care. And she's just going through all these things about how she doesn't care. So now all these women across the United States are putting in their application to the We Don't Care Club. And it's all of them video. And it's for the moms out there, we don't care that your water bottle's from 1982 and I don't care. I'm not going to buy you something. And it's all these moms with these napkins that it's their application to the We Don't Care Club.
It's liberating to know that people are in it with you.
Yes.
And I mean, hello. We're all doing it. We're all going through it.
This is the group text.
Yep.
This is absolutely the group text. So Connie, what are your plans for this summer?
Oh, actually, next week, Gulf Shores for a few days, and then I'm going to Maine for the 4th of July.
I want to go to Maine.
Wait, what part of Maine?
We want to go up the coast, so Portland, and then maybe if we have enough time to Acadia National Park.
Oh my!
I'm a national park girl, so I love that for you, Con.
Last week I was in New York for the first time ever. There's a new autologous fat injections called Rejuvenation that was had a conference, and we got to see behind the scenes of their laboratory and the processing of the fat, and extended the trip for a couple days and experienced New York for the first time. And the hustle and bustle of New York is crazy, but we ate and drank our way through. It was awesome.
I was about to say, I've never been.
Really?
I've never been to New York City.
Okay.
I want to go.
Yeah, it's awesome.
Go.
I get to show you all the things.
Y'all didn't have you didn't have the kids?
No.
It was just see. This is a different type of vacation.
Yes.
I was talking about this with my neighbor last night. when you go on vacation, everybody's on vacation but the mom.
Uh-huh.
Everyone is on vacation but mom.
Yeah.
And then
truly,
we just did an adult trip. We had 5 couples that last week went to celebrate a friend's 40th birthday.
How was
and
Turks?
It was in Turks and Caicos, and it was I can't even. It was literal paradise.
And then you come back and it's a nice reset. And they're like, okay, back to the console.
I was like, I can't wait to get back to Baton Rouge. This is going to be lovely.
Right.
But that was a vacation. I was like, this is a vacation.
Yeah.
Oh, it's going to be so good. All right. So
what are we diving into today, ladies?
All right. So we are going to talk about ThermiVa. What'd you say, Connie?
All things girly talk, for sure.
This is it. We're going to talk about vaginas a lot and how we can help each other in this. So we're going to talk about a little thing called ThermiVa. And Connie, I'm going to kind of let you, since you are the esthetician expert here, I'm going to kind of let you dive in to kind of let us know what ThermiVa is.
Okay, I want to talk about just like the vagina.
Yeah.
And how hormones affect the vagina, how natural aging, childbirth,
everything,
trauma, all these things for years and years have affected a body part. And, it's kind of taboo to talk about it, but it is just like any other part of your body. The vagina, it ages.
Yes.
Hormones and life experiences influence it. And we are all having, those changes. I was doing obviously research before this, and there's things like in 1850 BC, Egyptians would you put honey and use like acacia leaves for birth control.
I was just like, oh my God, like yeast infection.
Yes.
Like, oh my God, yeast infection.
They would, in Rome and Greece, they would soak pomegranate and vinegar in these like little linen cloths to cleanse and use as different types of birth control and to keep it sterile and to keep it tight, all these things. So we're not new to this. It's just, modern medicine has brought us to a different phase. So the advancements of lasers and things are truly remarkable.
Well, and like the vagina in general, just remarkable. The things that it goes through, the childbirth, the elasticity of everything, being able to go back after you birth a 9-pound child. I mean, it is truly it's miraculous the way that it can just do all the things.
Yeah, truly.
It is the superior of the two.
So yeah, like Brittany was saying, Connie, what is ThermiVa and why do people, not even just ThermiVa, why do people seek vaginal rejuvenation? Because there's tons of different devices that we can dive into if we want, but kind of start there.
So ThermiVa, I feel like it is the most underrated procedure that we offer. Because the majority of our patients are females, and like you said, it's taboo to talk about. But one of our most popular treatments is laser hair removal. And when I see a patient of mine growing facial hair, that usually indicates that she might be on hormone therapy, which would also let me know that she's probably having some issues downstairs. So sometimes I open up the conversation, about ThermiVa in a way of, are you on hormone therapy? Are you having dryness? Are you uncomfortable? And then I start talking to the patient about what ThermiVa is. And it's such an easy procedure. It's radiofrequency, and radiofrequency is going to deliver heat into the vaginal canal, which is going to stimulate collagen production. So the crazy thing is that it's multi-beneficial. It's going to help you with urinary incontinence. It's going to wake up those nerve endings. So, when you're intimate, you can actually orgasm better. And, that might be an issue for a lot of us. And then, as far as moisture levels, you're going to have an increase of lubrication. There's so many things that you're going to benefit from with ThermiVa.
Yeah, that's what I'm like.
Laxity, tightening.
But can't ThermiVa also alter what the vagina looks on the outside as well?
Yes. So the labia majora is also going to be affected. So that's the great thing about ThermiVa is that we can also rejuvenate the appearance of the labia. So I've had a recent patient come in and she was like, I don't know if I'm a candidate for surgery or if ThermiVa would help. And, it's not going to give you surgical results like a labiaplasty would, but it's definitely something that she could do in interim if she's not quite ready for surgery. But yes, it will actually, anything that's lax and kind of hanging, it will plump it up. It will give you volume as almost like you would have a filler in the labia. So it's pretty nice aesthetically as well.
Yeah. So what happens, like in layman's terms, is it's a wand. It looks like a very skinny.
It look like a ruler, like a.
Can you see it?
Oh, there you go. There you go.
So, it's like the size of
Connie's
a finger.
Here. Yes, that's right. The size of your finger. So it basically, the heat that is radiated from that device, that causes basically micro trauma to an area. And so whenever that happens in the body, the fibroblasts will be recruited to the area to, so say, heal it, even though there's no true damage. Heal that area with the fibroblast recruitment, which will then stimulate the collagen and elastin. But the big thing for this is the blood flow to the area is majorly increased. And we were talking before the show, that is going to help with the dryness. That is going to help with the sensitivity.
I was about to say sensation.
Yeah. That's the bigger of the
lubrication.
I actually encourage patients the day of treatment to go home and have sex if they want to, because those tissues are, the level of intensity is there. They're nice and plump. So it's going to be more enjoyable for her.
Connie, I would think that would hurt the day of.
Well.
It doesn't hurt
the day of, like, oh no, it feels like a hot stone massage. And because this is so small,
just inside your vagina,
like
a hot stone. It's a hot stone massage inside your vagina.
Correct. Yeah, because we're always moving it at 360 degrees counterclockwise and clockwise. So you're never going to have like a really high concentration of heat. It's just going to be a warmth inside of the vaginal canal.
Okay, so talk us through the actual procedure.
So first of all, we have to prep you. So the main thing that we need on file is a pap smear within a year. We want to make sure you're nice and healthy down there. And a contraindication would be obviously pregnancy. If you have any electrical devices in your body, like your pacemakers and your defibrillators, we can't have you have the treatment because that just might interfere with that. We don't want you to have any kind of skin infections or UTIs before the treatment. So we want to make sure you're free and clear of all of that. Menstruation is actually not a contraindication, but you might want to reschedule just for comfort if you are menstruating at the time. And then we want you to shave really close in that area, like the day before, because this little metal contact, we want to make sure that it's against the skin closely, so you don't have any like little tiny pricks or shocks. But that's like prep. And then you come in for the treatment and we have you empty your bladder. We have the room nice and set up so you're cozy. We're not going to have any spotlights on you where it's nice and bright and you feel like, oh, this is scary. Most patients are a little jittery on their first treatment, but you can either like bring headphones and just chill out, play on your phone. My patients and I chat, we catch up. So the awkwardness of it kind of dissipates fairly quickly. But ultrasound gel is applied. We have a grounding pad on your inner thigh. And then this little wand inserts into the vaginal canal. We spend about 20 minutes inside the vaginal canal just heating it up. And then we do about, 10 minutes on the outside and making sure that we are also stimulating that tissue in the labia area. So ultrasound gel is wiped off and you can go. You can
no restrictions.
No restrictions, none whatsoever.
Encouraging sex as you walk out the door. Could you just imagine the phone call to your husband like, hey, listen, I'm leaving my esthetician. Can you meet me somewhere?
Well, a lot of times my patients won't tell their husbands and they just want to get their feedback. And, I'll give you a story. The other day, I had a patient who she was just suffering with excessive dryness and she was so uncomfortable. And she told me they were in the intimate aisle at Target and her husband's like, hey, I don't feel like we need to use any lubrication anymore. What's going on with that anyways? I wanted to ask. And she said, oh, I'm just well hydrated. So
I've just been really drinking a lot of water. That's hilarious. I remember, so we had a patient that that was going over to WPS to, she was getting ThermiVa. And her husband, they had 5 children. They had 5 kids and they had finally all flew the nest. Everybody is out at this point. And she was like, so now she was on testosterone. He was on testosterone. They were starting to feel like, so it was one of those things where they both wanted to. They were like, yes. They were like, we're no longer having to like sneak around and have sex in the closet. Like we can just, like there's no kids here. This is amazing. But after 5 kids, hormone changes, all that kind of stuff, and her being on, she was on test and estrogen and everything to kind of help with lubrication, but she still just had extreme vaginal dryness. So we got her to go over to Weiler to get ThermiVa. We had to go and she came and she's like, y'all. It's like, yeah, this is, and she was doing like the treatments. I know it was like, isn't it like recommended to do like a series of them? So, and she had done them and she was like, okay, yes. So now we've got the testosterone. Yes.
Right.
Now we've got the lubrication from the ThermiVa. She was like, this is it. We are back in honeymoon phase. I was like, and it like, as a mom of 5 children, I'm like, you get it, sister.
Empty nester after 5 kids. What?
5
That's
kids.
Goals. Big time goals.
5. Well, you're almost there.
I mean,
you've got 4 children at all.
Connie, what are the, how many treatments? How far apart?
We recommend 3 treatments and usually scheduled every 4 to 6 weeks apart. And then, your results can last up to a year. We just ask you to come back in for a touch-up treatment, usually a year from your anniversary start date. But I have patients that wait 2 years, especially those that are suffering with urinary incontinence. They may feel like they want to maybe have more treatments, but really just they will have a lot of satisfaction after just 3.
Which I feel is huge because that's another thing. Speaking of the We Don't Care Club, we don't care that when we laugh, we pee on ourselves. It's like, after you've had multiple
jump on a trampoline, I'm out.
That's what I'm like. I was fortunate. Both of my girls were over 9 pounds. And God bless, both of them were sectioned. And so
they were sectioned?
They were two. Cecile was stuck. She couldn't get out. It was a situation. I was like, but this is what you get for having kids with, small humans.
Oh, I was about to say, your husband is very large.
This is what I get. But after that, I was like, I wonder if I had a section if I'm going to pee on myself. I'm like, I wonder if this is going to happen. And I haven't, luckily, but like me and my best friend were talking about it. And she laughed really hard. She's like, oh, I got it. I'm sorry. She's like, I peed on myself. And I was like, wait, we can help. Like, wait, let me introduce you to my friend Connie. Like, she can assist in this. But all of us, I'm like,
yeah, it's true.
That's it. I mean, if you just get a really good joke going, that's it.
I jumped up at a baseball game last year, screamed, and I'm like, oh.
You're like,
here we are again.
Hey, I'm just going to run to the restroom, just hang tight. I'm going to come back. No one do anything until I get back. No, that's funny. But I think, that's a huge thing. I mean, that's universal. I don't know.
We Don't Care Club. Okay, I'm bringing signs.
Oh my God.
We Don't Care Club.
Like, it's just a napkin that's a closed.
So good.
It's so good. But I mean, I know like urinary incontinence after kids and all this kind of stuff and just growing older, I feel like it's so common. So common.
I guess too, Connie, the patient population that is a good candidate for ThermiVa is very vast because from urinary incontinence to lubrication to
sensation,
libido, sensation,
outer
everything.
Appearance. Even if you wanted something like that, I mean, it sounds like anybody. And I mean, what's the age range of it? Just anybody?
Well, yeah. I mean, anyone that's experienced childbirth, whether they had their baby vaginally or even C-section, their pelvic floor was still affected. So I just say, if you're a new mama, you may not be done with having children, why don't you wait until you're finished? I wouldn't want anybody to, waste their investment. But it's anybody could have it, of childbearing age and up. So I think the majority of our patients are probably around, I would say 40, 50, even in the 60s. Yeah.
Well, that's that perimenopause. We always talk about that perimenopausal phase where everything starts changing and you start having the dryness, the decreased libido, and stuff like that. So being able to use something like ThermiVa in conjunction with hormone therapy is just, it has to be life-changing, because then not only is that want back, like the actual logistics, the physical logistics is back. Right. So pairing those two together, fantastic. And, like Connie was saying, if you notice somebody that's on that therapy and you're like, ooh, you could probably benefit from this.
Yeah, absolutely.
Because you would hate to, I also feel like, once again, women, it's like finally we get to a place where we can start hormone therapy and all this kind of stuff. And even with hormone therapy, unfortunately, some women don't get that, increased lubrication back with hormones and stuff like that. Sometimes you just have that vaginal dryness that's not gonna, this is just, this is fantastic. This is a wonderful treatment.
No recovery. No, I mean, hello, that's huge. No pain. That's me, Con.
I can't wait for this vaginal stone massage. Like, this vaginal hot stone massage. That's fantastic. All right, what else? What did we miss, Connie?
As crazy as it is, that's pretty much it. It's such a simple, easy procedure. I think the biggest feat would be the conversation. Getting it started with the patient, bringing it up to the patient, letting them feel comfortable, telling you these intimate things, because I feel like that's probably the hardest part of it all, is just feeling comfortable with your provider and saying, hey, I'm struggling. I know I'm not really supposed to talk about this, because it's my hoo-ha, and who talks about that unless we're just trying to get all the hair off of it with laser. No one really says, hey, I'm really struggling. And it's a big deal. I mean, the thing is eventually, hopefully, if we don't have a strong pelvic floor, we might end up in depends. And who wants that? So this is a preventative thing too. If you feel weak in that area, this is the same as like treating your face. We're rejuvenating all parts of the body, and especially the intimate ones.
I'm sitting here trying to do Kegels, Connie.
Like as
what did you say, Dave?
Doing Kegels.
I'm trying to do Kegels as we talk, because here I'm gonna be in depends.
That's it. I'm like, oh God, I remember like after having the baby, they're like, all right, don't forget your Kegels. I'm like, I'm trying to keep a child alive that you just handed me, much less remembering to do Kegels. But that's what we don't care if you're uncomfortable with the amount of times that we've said vagina. Talk to somebody about your vagina. Like, talk to your esthetician, talk to your doctor, talk to your friend, somebody, because everybody's got one.
Absolutely.
And everybody's probably going through the same thing. I'm totally on board with this. This is fantastic. Absolutely fantastic. So we have someone who is going to join us and kind of share some of her journey with ThermiVa and everything. So we're super excited about that, and kind of seeing it from the patient standpoint. Before we get to her, we want to thank Weiler Plastic Surgery Group, the #1 largest plastic surgery group in the state of Louisiana, with expert injectors, 5 physicians, all around the South Louisiana.
That's right.
Also, Rejuvime Medical, your HRT, hormone replacement therapy, and GLP-1 go-to one-stop shop. And that's it. And so let's take a quick break and let's talk to a patient about her experience with ThermiVa. We'll be right back.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters, we all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
My name is Amber. I'm from Gum Springs, Louisiana, and I'm currently on semaglutide. I started my weight loss journey a few years prior and just kind of struggled with getting to like that final weight loss goal. I decided to get on semaglutide because I was really working towards like those last 20 pounds. Working with Rejuvime is so simple. When you really have that person that's like in your corner, like they're cheering you on, they want to see you hit those goals. I feel like I'm healthier, I'm at that wonderful weight. I just feel really confident, feel comfortable in my skin.
Hey everyone, welcome back to the consult. We have got a real live patient here that is going to talk to us about her experience with ThermiVa, as we covered a little bit before. So
she is going to remain anonymous, but she has been a long-term patient and friend that we have known forever, huh, Connie? I mean,
Yeah. Years.
Long time. So we want to just get a firsthand experience from her. I want you to tell us, why did you even decide to ask Connie or talk to Connie about ThermiVa? Give us a little history.
Well, after having 4 kids, it really puts a little damper down there. So I decided to do it mainly for the appearance and the tightening, and it honestly helped with so much more.
Appearance and tightness, and then tell us about your treatments. How was that?
Treatments were so easy. It was a perfect amount of time, which was great because I could go on my lunch hour and then get back to work. So it worked great for me because of that.
how quick did you start seeing results after receiving the treatments?
After the second treatment, I felt the results, and then after the third is when I saw them. It was remarkable.
Oh, that's amazing.
Wow.
That's amazing. That's fantastic. So you said that it was for appearance and stuff. So you said after the third treatment, you started to see a change there. And then you said after the second treatment, it started to feel different, which is 2 treatments.
Yes, amazing.
Two lunch break treatments. And you tell me that sex could be better for, me. That's
both parties.
That's what I'm like. I can work that in.
Right.
Like I could absolutely work that in.
So tell us what you experience now. What has improved from before your treatments to today?
Besides the appearance, like I said. And also, the thing is, even 8 years later, I don't have to cross my legs whenever I sneeze. So that's another benefit of it.
Unlike Taylor, you can jump on a trampoline.
I used to have to cross my legs for a while when I would sneeze, but now I don't have to. ThermiVa was the reason for that.
So you said 8 years. You've been doing this for a hot second.
Yeah, I mean, it's been a while, but it still looks pretty. I feel that it's still tight. I don't know if I can say that, but it feels much better than it did previously before it, for sure.
Oh, girl, you can say anything on this episode. This is the girl episode where we're just going to talk about vaginas freely. You can say anything at all.
What would you tell a patient that was considering they have, just normal women perimenopausal symptoms? What would you tell a patient that is questioning it?
I would definitely tell them to do it. Even to this day, I talk to people who are younger. I was just recently at my job talking to people and telling them how much it helped me. And she was asking me, I told her she should definitely do it. One, because she was concerned with the look of hers, and she's only had 1 child. So I told her it would definitely make a difference. And then I whip out my picture, which is crazy, but I still show people because that's also a concern. I know that I've read up, even after the fact, that it helps with dryness and stuff. It may not be for everyone, but to me, the appearance and the tightness, in my experience, made it worthwhile.
I love that. And I love that you're talking to other people about it because like we said, it's always viewed as like this taboo thing. But if you wouldn't have said anything or if she wouldn't have said anything, then obviously would have never gotten to the point of saying like, hey, you should go see Connie. This is amazing. This helped me so much.
Yeah.
See, women helping women.
I mean, to this day, I tell people, it's helped me so much. If they haven't done it themselves, they can ask people who've been through it. it's been so many years and I'm still loving the results. I think, it gives them the confidence to say, hey, maybe I should do this too.
I love that.
Good stuff.
Well, thank you so much for calling in and sharing your experience with the ThermiVa procedure and everything, and with Connie. Shout out Connie, just helping women all over there on the North Shore. Thank you so much for that. And I mean, do we have anything else, Taylor? I'm
going to leave Connie with the last words.
Yes.
Obviously come in for a consultation.
Yes. So consultation, feel comfortable talking about these more private issues that you might be having. We are so ready to help you feel more comfortable and connected with your body, and help you with these issues that you might have, that not only maybe the appearance of it where you're not feeling comfortable in a swimsuit, or, just not wanting to, experience that rapid aging that, we all experience anyways. We can slow that down for you and make you feel more comfortable in your body.
I love that. It's we don't care. Come talk to us about it. It's like, we don't care. Come talk to us about your vagina. We will listen. Well, Connie, thank you so much again for joining us, our expert esthetician over on the North Shore, for sharing your expertise in this. Gals, speak up. There's always someone out there that is either going through it, been through it, gonna go through it, that we can all help. There's no need to gatekeep on all these fantastic things that we have to help us out. All right. So, the whole drill. Like and subscribe, do all the things, follow us on all the platforms. Please make this obviously the best show since he's not here, so we can rub it in his face.
Go ThermiVa.
I know.
Girl talk.
Go Girl Talk. And we will see y'all next time for our next Girl Talk session. See y'all next week.
Bye, guys.